Good afternoon, ladies and gentlemen. My name is Gusciora. I'm the representative from the 15th District along with Liz Muoio. Senator Turner is with us in spirit. She's at a funeral in Essex County. I'm also joined by Mayor Jackson of the city of Trenton and County Executive Brian Hughes, as well as the two premier capital city hospitals, Dr. Al Maghazehe from Capital Health and Chairman Dr. Joseph Youngblood from St. Francis, Chairman of the Board. Ladies and gentlemen, we understand the complexities of the high cost of health care and efforts to cut costs on behalf of the insured. But Horizon, with their announcement of their premier plan, has created a situation that if you like the plan that you have, you won't be able to afford to keep it. And what was left at the cutting room floor were two premier capital city hospitals, Capital Health and St. Francis hospitals. They were not brought to the table. No negotiations occurred in good faith. And if you want to keep your plan that includes those two hospitals, you have to pay higher premiums or higher deductibles. We don't think this is fair, and we are calling on the commissioner of the banking and insurance to put a hold on this plan until there's more transparency and there's a public airing. As a public representative of the capital city of Trenton, Horizon gave us no notice whatsoever, and the first contact we had with Horizon was after the fact. I don't think this is a way to do business for a nonprofit in this state that supposedly cares about its insured, not to include the two capital city hospitals, not to include legislators, and not to have any kind of public airing. With that, I'd like to have my colleague, Assemblywoman Liz Muoio.
Good afternoon, everybody. Essentially, the letter that we are submitting today goes to the Department of Banking and Insurance. It will be signed by Reed and myself, by Mayor Jackson, and by the County Executive, Brian Hughes. And what we're essentially asking is that the Department of Banking and Insurance, under their authority of the Network Adequacy Rule and the Health Care Services Act, to review and place on hold the implementation of the Horizon Blue Cross Blue Shield Omnia Health Alliance Plan. One of our concerns is the time is of the essence in this. In less than 2 weeks, you'll have tens of thousands of public employees who will be entering the open enrollment period and will need to possibly make major changes in their health care coverage based on this new plan, the details of which we still are not clear about, and we have serious questions as to the process whereby the plan details were arrived at. Our main concern is that our residents have access to quality, affordable health care. This is going to be the most affordable product that our largest insurer in the state is offering, and yet it will not be readily accessible to some of our areas that are most in need of services. The result will be the opposite of what appears to be the intention of this new plan, which is to try to encourage preventative, quality, low-cost health care, but by putting up barriers that make it less accessible, you'll discourage people from actually seeking out preventative care at the front end. So we understand that there are different tiers and that the two hospitals within the city will be part of the system. We understand that they will be in Tier 2, but it will cost people that want to utilize those hospitals more. From what we're told, several $1,000s more per year in order to utilize those facilities rather than going out to out of the Tier 1 hospitals. If you're a woman who wants to give birth in the county in a Tier 1 hospital, that will no longer be an option. Right now, many of the women from Trenton who are having babies will go out to Capital Health in Hopewell Township. They're provided transportation to get out there. They will no longer be a Tier 1. They will not be a Tier 1 hospital. The most affordable plan that women can in the city or anywhere else in the county can now access. So we're concerned on many levels, and we're very glad to have this partnership up here of people that share our concerns. And I'd like to now ask the County Executive, Brian Hughes, to come up and say a few words.
Yeah, I'll be very brief. I'm signing this letter today because I feel the lack of transparency throughout this process. I heard about it like the legislators heard about it by opening up the paper one day. It is not a process that we would expect from the largest insurer in the state of New Jersey, but it was not a process that I think was fair to the two urban hospitals in the city of Trenton. We are talking about the capital city and the capital county, and both of their hospitals will be left out of the Tier 1 pricing. And I believe that that simply, on the face of it, is unfair. I am a St. Francis baby. I'm sorry to say that to Capitol Health. But of my 10 brothers and sisters, 6 of us were from St. Francis. And the idea of my parents, my poor parents, on a cold winter day, scouring around the countryside trying to find a level 1 hospital to have all of us kids just is terrible to me. This isn't a joke, though. This is serious business. People are coming up upon an open enrollment period. They don't know what it's going to cost. They don't know what networks to get into. There's too much mystery in this process, and that's why we're signing this letter today. Take it back a little bit. Let's figure out why these alliances have been put together, how these levels and tiers have been placed together, and come up with a reasonable way to have the city of Trenton represented and the Tier 1 hospitals as they certainly should be. Thank you very much.
I'd like to introduce our Honorable Mayor, Eric Jackson, the City of Trenton.
Thank you, Reed. Thank you, Liz. Good afternoon. I'm standing this afternoon with our local elected leaders and leaders of our healthcare community to express our concern over the lack of transparency and communication in the creation of Horizon's Omnia Alliance. We are collectively calling on the acting commissioner of the Department of Banking and Insurance to place a hold on the scheduled January 1 startup of this new initiative. We are asking, and I have asked, for full transparency for the criteria used to select the 22+ hospitals included in this new alliance. Moreover, I've asked the question, why have the premier hospitals in my capital city been excluded? I believe this will create a major gap in the health care coverage for Trenton residents and in the surrounding areas. I am more alarmed as this inclusion of St. Francis Medical Center and Capitol Health would leave city residents without critical maternity and state-of-the-art cardiac care from a Tier 1 hospital, as you just heard stated. We all of us standing here, and I believe Horizon Blue Cross and Blue Shield should be doing all that we can do to ensure better access to cost-competitive quality health care for all residents, not a select few, including those who are under and those who are uninsured. Thank you very much. We stand together to make sure that this is postponed so that we can have a transparent look at the process. But moreover, as the mayor of the capital city, we have to ensure that access to competitive quality health care is a must for every resident. That's why we have collectively put this letter together, and we'll sign this letter and send it to the acting commissioner to ask him to place a stay on allowing this to go forward because of the critical impact it will have, not only on our residents, but let me add, on the financial stability of our hospitals, which is a real issue for me as a mayor in the city of Trenton. Thank you very much.
I'd like to call up the 2 hospitals from the capital city, but I also want you to know that we're joined with the Trenton Teachers Association, the president, Naomi LaFleur. They have 600 members that live in the city of Trenton, and they all have the Horizon default plan. And if any of them are the 600 teachers and custodians and other members that reside in the city of Trenton, their hospital care is going to have to be outside its walls. I don't think this is fair to the employees, and again, we're calling on Horizon to do the right thing and open up its doors. So I'd like to introduce Dr. Maghazehe from Capital Health Systems.
Thank you. Thank you. First of all, let me take this opportunity and thank the assembly persons, mayor, county executive, and my colleagues for being here today. Most of what I would say has already been said. Just want to add a couple of things. The most significant issue from our point of view is really the way this was done. We were not given any notice. We were not given an opportunity to participate. We did not, quite frankly, even know this was happening. And we saw it just the same way as everybody else did. So the question now is, what criteria was used to pick these hospitals? From my point of view, if you're worried about patients and not anything else, you look at access as the #1 priority. St. Francis with cardiac surgery in the region, Capitol Health with maternal child program, especially our level 1, our NICU program. These are critical programs. Neurosciences program at Capitol Health, completely excluded. And quite frankly, I don't know how Horizon expects women that are pregnant to have a relationship with their doctors to all of a sudden interrupt that relationship and travel 15 miles, 10 miles, whatever it takes to go to a tier 1 hospital. It's first of all, it's not just, and quite frankly, I don't think it's a good program. I don't think they gave it enough thought. I don't think they considered all the factors. If the question is population health, as we've heard, population health played a major role in this. Well, Capitol Health, and I'm sure St. Francis, along with Trinity, have very, very advanced population health program. I don't think our program is any less than anybody else in the state. In fact, it's probably more advanced than most hospitals in the state. So there are issues, significant issues that we need to really look at and consider. I think those hospitals that are excluded should be given equal chance to participate or not participate. We have not been able to get clear information from Horizon, and not only us, but even public officials have not been able to get that information. So we are here, standing here united, and I just hope that all the other hospitals, and we're simply going to try to do this, join us in this effort to bring this to some kind of a compromise where everyone has a fair shot at participating in this program.
Thank you.
Also, just I want to bring up Dr. Youngblood, but I want to acknowledge our distinguished Council President, Zachary Chester from the City of Trenton, and our freeholder, Sam Frisbee, both Trenton residents who are also joining us. Dr. Youngblood. Oh, Vince? Yes, Vince Castellano.
Thank you very much. Good afternoon, everyone, and thank you for being here. It clearly demonstrates that you all care about this very important issue for the residents of Trenton, the patients. I want to thank Assemblyman Gusciora, Assemblywoman Muoio, Mayor Jackson, County Executive Brian Hughes, and others for your leadership in addressing this critical issue. We can't ask for better partners in this effort. Clearly, this is something that is critical to the community's access to high-quality health care, and that we keep that whole. We heard about the cardiac program at St. Francis and the investments we made in minimally invasive robotic cardiac surgery, the OB program, the neurosciences program, clearly at Capitol Health. And St. Francis is more than a hospital. We're a safety net for our community. I can't tell you the angst that this has caused for the employees of St. Francis. Over 1,000 employees and several hundred medical staff members. We just in June, we were recognized by Horizon. I brought the cup here along with the photo shoot. We were recognized in June. We celebrated this with all of our employees. And only to find out now, being a top performing hospital, only to find out now that we were excluded from this, it really has us scratching our heads and wondering, what was the criteria employed to include us? And certainly our employees and the medical staff are asking us that very question. So with this decision to exclude not only St. Francis and other local hospitals, they've created this huge gap. And members living in and working outside now are faced with a difficult decision to travel or face huge costs, huge out-of-pocket costs. Every dollar counts. And certainly, we feel that this is just not right. All Horizon members, regardless of where they live, they deserve a right to choose where they receive care and by whom. Instead, Horizon has inconvenienced its members and left them with no choice. Horizon's decision also threatens the hospital viability. We rely on every dollar to support our mission. And clearly, the millions of dollars that are part of the Horizon existing contracts are at risk if there's migration. And we do anticipate, because of the deep incentives that exist in this new plan, that there will be migration away from the contracted plans that we were a part. We've made numerous attempts to be considered, but despite our effort, they made a decision to exclude St. Francis, other local hospitals, from this very limited alliance. Horizon is yet to provide the criteria. You've heard this, time and time again, and this is a deep concern of ours. Being shut out of the process is deeply disappointing for our organization and other organizations. Again, I mentioned earlier, we were recognized for being in the top 10% of performing hospitals as determined by Leapfrog. So the Leapfrog group clearly has evaluated us, and we've had a consistent record of an A rating on Leapfrog. We deserve access, we deserve an opportunity to be included and to have an open discussion. We've also made significant investments in population health. So population health is not the reason for exclusion by any means. With our 140-year history, we want to be able to deliver a message with our board members here present today, our leadership, to our employees and our physicians that were part of this very important program. So I want to thank you again for your time and attending. I'm happy to answer any questions at the conclusion